Good day to all of our English-speaking community. It's been some time now that I gave you an update on where we stand with COVID. I'll try to keep it short this time, and then maybe later on this week or the beginning of next week, I'll give you a little bit more expanded update on the numbers. For now, there are just a couple of things I'd like to discuss with you. First of all, you might have noticed these past couple of days that the total number of new positive cases has dropped. That's a good sign. However, I need to warn not to jump for joy too early. This might be spurious, it might be today, yesterday, but it might also be that we jump back to the numbers that have become usual for us for these past couple of days. So let's not get too giddy and too happy all right away. Let's hope to continue with what we're doing, and hopefully we'll get things back. So that's one thing. However, I'd like to talk to you about that, about keeping things safe. Because we're noticing that people are asking questions, understandable questions about, look, but I don't have any symptoms. So why do I have to stay inside? I'm fine. There's nothing wrong with me. I mean, you tested me positive, but I'm okay. And I don't have anything, but now not only are you telling me to stay inside, but my family has to stay inside too, in quarantine. So I have to be isolated, my family has to be in quarantine, I'm not ill, they're not ill, why do we have to stay inside? And people don't. They leave. They say, well, look, I don't believe it, I'm fine, there's nothing wrong, and they leave and they go out anyway. There's a problem. And this is one of the issues that plays a role why we're seeing still transmission continue. And it will continue because that's the behavior of people, but we can try to limit that as much as possible. So let me try to explain. Again, I've said this a couple of times, we're not so afraid of the disease itself. Again, up to 50% or maybe even a little more than 50% of the people who are infected with SARS-CoV-2 or COVID-19 as we call it. Over 50% of these people don't have any symptoms, don't feel ill at all, but they are able to transmit the disease to others. A great percentage of the population, of the people who are infected, they don't get severe disease. Maybe 80 to 90% of the people don't get severe disease. It's about 10 to 20% who do get it. And who are those people? Who has greater risk of contracting severe disease? Those, the elderly, those who have chronic disease like diabetes, cardiovascular disease, kidney disease, cancers, different types of infection that might impede your immune system, etc. They are not the only ones. Even if you don't have all of this, even if you're younger, you also might have severe disease. The risk, however, is smaller. The group I just mentioned, the risk group, has a larger chance of having more severe disease. So, these are the groups that we have to protect. Why is that so? Why do we have to let everybody do all of these things to protect a smaller group? First of all, because we're human. Second of all, because we're talking about ourselves, we're talking about the family, we're talking about people. But also, most importantly, you're also talking about yourself. You are talking about yourself in the sense that if a too large proportion of the community, let me say it this way, if we talk about 10 to 20%, if the total amount of people who are infected at the same time becomes larger, then that percentage also becomes larger. And if in absolute numbers, there's too many people who are severely ill, this reflects on a burden on the hospital care, that they will need to be admitted, and they will also need to be admitted to an intensive care unit if things go really bad. And if that happens, that is a burden on your care system. And that means that it's not only COVID, because COVID people who are interned in the hospital, they might be there for a very long time. And this has an effect on general care itself. So there's less available space and personnel to deal with the common diseases that we come into the hospital with anytime. So in the long run, this might have an effect on all of us, not only that group of people who are ill. So this is the reason why we have to do all of these things, to try to keep the total amount of people who are infected on our island relatively at a lower level so that we can manage that system as much as possible. That's number one. So I hope that's understandable. And therefore it's necessary that even if you don't have any symptoms, even if you feel well, even if it's so that you think you're fine, but in reality you're not, it's important for you to stay inside because you can transmit the disease elsewhere. If you don't do that, you are also helping to spread the disease more than it can be. This already happens for people who didn't test and who don't know. Those are the reasons why COVID will be there for a long time and it will spread. It's there to stay. It's not going to go away, which is all right. We can deal with it. If we manage to keep the transmission on a relatively low level as it is now, without too much burden of disease coming to the hospital, we can manage it. But it shouldn't surpass that amount, so you can help. If you've been tested positive, please stay inside. Please stick to us with the rules. Don't go outside because you think, but I'm better, I don't have any symptoms. You can go outside after it's been determined, either together with your GP or together with us, and we say, it's okay now it's time that you can leave. Don't go out before that, please. Please keep your family safe. Let them also stay inside, because you might have infected them, and if they walk outside or go outside and go about their business, go to work, they can be the source of infecting others. We've seen that happen before. We've seen it happening now. So again, please work with us. Please help out. Please let's stick to the rules. There's something else I'd like to talk to you about. People are sometimes saying, well, there's a difference. It's what's going on the island. You're opening up for other countries while you're telling us that we can't go out at night, there's a curfew, we can't have dinners, parties, etc. So there are these restrictions on gatherings. And that's contradictory. So you're opening up for countries that have a higher risk, and on the other hand, you're taking these severe measures elsewhere. There is not a real contradiction. We're trying to get into measures that have less impact as possible on the economy. Because we know, it's not only an economic standpoint, but we know that by hitting the economy too hard, that will have an economic impact, but it will have a social and it will have a health impact as well. People may lose their jobs. People lose their money that they have to take care of their children, to take care of their family, to have a decent diet. That has an impact on their health. So it's also about health. So we need to find these balances in which measures do we take to try to limit the increase of cases on the island as much as possible and still allow us all to live. Now, so if we open up the country for other places to come into, because we think we can reduce the risk of introducing the virus by using PCR tests beforehand. And we probably reduce that risk more than what we thought beforehand. Or not probably, it's been proven that it's more. So therefore we can reduce the risk of coming in. Is that contradictory to taking measures here? No, because these measures here are directed towards what we can do to limit spread, which is try to maintain distance. Try to avoid lots of people together bunching up, because that's where you can spread disease. And those measures, they count for those coming from abroad as well as those who live here. So yes, you can come in, but the rules are there for everybody. And those rules are directed towards behavior of whomever. Our behavior of our visitors. So there is a balance here. It sounds contradictory maybe, but it is not. Last thing I want to discuss with you specifically, Aruba, our neighboring country, is doing well. Their transmission is going down. We discussed this together. Hopefully with us, it will also at least stay at the same level or go down also. But we all both conclude that the level of risk, looking at the almost equal incidences that are taking place in both islands, make it so that we can go back to as it were above, which means that if there's equal risk on both islands, we already took away the restriction of quarantine for Aruba, but that we also take away the necessity of doing a PCR test because we consider the transmission going on both islands equal. So equal risk, equal problem. So we hope by Friday, together with our neighboring island, to be able to announce that as of Friday, it will also not be necessary to do a PCR test prior to going to Aruba from Curaçao or coming to Curaçao from Aruba. As I noticed, or I don't know if I mentioned it before, but in a different video, we'll amplify on how the country list is made up, because there are questions about that as well, and we understand. So I like to keep it at this for now. Thanks very much for your attention. I hope it was clear, and have a good day.